Peter Ducharme, Program Director at Bridge Over Troubled Waters. Thanks so much for joining us today again.
Thank you so much for having me back.
I hope you've had a great summer. We saw you last time in June talking about some of the great updates from Bridge, but now we're here talking about the Boston Public Health Commission Narcan vending machines. So tell us a little bit about this new machine you guys have sponsored, and how has the reception been so far?
Yeah, we're super excited to have a new public health vending machine. As you mentioned, this was being supported by the Boston Public Health Commission, kind of through their opioid settlement fund. And it's a really wonderful machine. It took a long time to get up and running. It took about 9 months just to design it and plan all the products with the young people here at Bridge. So for a while, I think people were wondering all this work, where's the machine? But now that it's finally here, everybody's super excited and everybody's taking part in it.
Absolutely. Yeah. So tell me a little bit about that process of deciding what products are going to go in the machine and how involved the community at Bridge was.
Yeah, so we knew that the machine had lots of availability to offer a wide array of public health products. I think a lot of people refer to it as a harm reduction vending machine, which is great. And then we also think about it just as like a public health vending machine because it has much more than just kind of typical harm reduction products. We kind of focused on three areas. We have sort of products around opioid prevention. We have products around infection and disease prevention, and then we have health and wellness products as well. So when we first heard we were able to get the machine, met with a group of young people at Bridge, kind of shared those three categories and thinking, what would you find most helpful to showcase in the machine, make sure that people have all the available resources and access to it. And that's how we came up with the supplies that are in there right now.
Right. And in true Bridge fashion, you checked in with the community, you checked in with your people to see what are the actual needs. Let's not diddly-dally around. Let's find out, what do people actually need access to. So tell us, why is it important to give access to these particular products and resources for those who need them, specifically the young people you work with at Bridge?
Yeah, so I think in coming up with the vending machine, we knew we wanted something that was free, convenient, and accessible. We want to reduce the stigma around young people accessing these types of supplies. I think the vending machine showcases just a great visual of all the different resources that are available, and it serves as kind of a continual reminder that young people can access all of these supplies that are in there. When I think about like young people that come into Bridge, and something that we often hear is, well, I could just ask staff for this. And I always think, I love it when young people say that. And that shows that that person is confident and advocating for themselves and asking what they need. But not everybody is at that same level. And so I think the vending machine offers an anonymous way to get these supplies, but also really showcases that everybody needs this and everybody gets the items that are in the machine.
Totally. And when you just shared that little story, I immediately thought, wow, they're comfortable enough to ask for something like that because they have such implicit trust with the staff at Bridge. They know that they're there for them. They know that they'll be met with no judgment. But like you said, not everybody has that. Not everybody has that person that they can turn to and say, hey, could you help me with this? So this is an incredible resource, like you said. But this is only one of 5 machines in the entire city. What can we do to increase that number and spread more awareness?
Yeah, I think it's so great, and we're so fortunate at Bridge to be one of the beginning kind of pilots for this and being one of the first 5. But I definitely think over the next several years, you're going to see many more of these public health vending machines popping up all around the city and in the different areas of the state. I mean, I think one of the great things about the way that the Public Health Commission is going about it is that all the machines in Boston are networked. So when young people come into Bridge, we're able to register them. They have a unique code to them that they can then actually access any of the 5 vending machines around the city.
Wow.
That are all free and accessible. Some of them do offer different sort of health and wellness supplies, but most of the core items are the same. And so, yes, they have access to 5 machines now, but I think over the next several years, we're going to see a real uptake of these machines just available all over the place for people.
Right. And having these resources at no cost can literally be life-saving. Have you heard any specific stories or anecdotes where somebody used the machine or somebody had administered Narcan and it changed the situation completely?
So, I think working at Bridge, the stories of young adults using Narcan to reverse an overdose on people that they know are an incredibly common experience, actually. And we know that people have been doing this even before we had the vending machine.
Right.
So we hear those stories a lot, and that's one of the reasons why we felt like being able to have this vending machine is going to be able to further help us disseminate naloxone, which is really a life-saving medicine, and teach more people how to reverse overdoses. And so it is a very common experience that we hope will even broaden and ultimately really save lives in the end.
Absolutely. And do you have any updates for us on great things happening over at Bridge?
Yeah, I think working at Bridge, we always have a lots of new great initiatives going on. I mean, I think in addition to the vending machine, what the Public Health Commission is helping to support us with, is a whole peer educator program where we are training young adults to then teach other young adults how to administer Narcan, how to use xylazine fentanyl testing strips, how to administer rescue breathing and other CPR and first aid. So we're super excited to get other young people training on how to do this, and then so they can then help their peers learn how to use all these interventions as well.
Fabulous. Well, it's a relief to know there are people out there who are ready to teach, ready to give, and ready to, administer what's needed if the situation comes. Where can viewers learn more about the vending machines and more about how to get better involved with Bridge Over Troubled Waters?
Yeah, I think everything to do with Bridge is really easily accessible through our website, bridgeotw.org. You'll find all the information about the vending machine, our services, and then all the other initiatives that we have going on in the agency.
Lovely. Well, thank you so much, Peter, for joining us. Hopefully, we'll see you again soon. And thanks for all the work that you do at Bridge.
Thank you so much. Appreciate it.